Parotid duct. That's the parotid gland, and emerging from it is the parotid duct. The parotid duct is formed when several interlobular ducts, the largest duct inside the parotid gland, join. It emerges from the parotid gland. It runs forward along the lateral side of the masseter muscle for around 7 centimeters, and in this course, the duct is surrounded by the buccal fat pad. It takes a steep turn at the border of the masseter and passes through the buccinator muscle, opening into the vestibule of the mouth, the region of the mouth between the cheek and the gums at the parotid papillae. Now, this lies across the second maxillary upper molar tooth. I repeat, the second maxillary upper molar tooth. What is the surface anatomy? It corresponds to the middle third of a line, the mid third of a line drawn from the lower border of the tragus to a point midway between the nasal ala and the upper labial margin. Midway between the nasal ala and the upper labial margin, a line drawn from this to the lower border of the tragus. It corresponds to the middle third of a line. That's the parotid duct emerging from its anterior border of the parotid gland, passing forwards across the masseter, pierces it, and then enters into the buccal oral cavity and opens at the papillae opposite the second upper molar tooth. The buccinator acts as a valve that prevents air forcing into the duct, which would cause pneumoperotitis. When we blow air, the buccinator acts as a valve and closes off the duct, preventing air from entering into the duct, which would otherwise have caused pneumoperotitis. Running along with the duct superiorly is the transverse facial artery and the upper buccal nerve. Running along with the duct inferiorly is the lower buccal nerve. The exit of the parotid ducts can be felt as small little bumps called papillae on both sides of the mouth and usually positioned next to the upper maxillary second molar tooth. The maxillary second molars. Now, the left papillae, soft tissue protuberance at the exit of the parotid duct, is clearly visible on the cheek opposite the second upper molar tooth. The parotid papillae opposite the second upper molar tooth. Again, the parotid duct passes anteriorly through the buccal fat pad superficial to the masseter muscle and over its anterior border, then through the buccopharyngeal fascia and the buccinator muscle. It then continues between the buccal mucosa and the buccinator to its opening in the vestibule of the mouth, located next to the upper second molar tooth at the parotid ampulla. The buccinator muscle ensures that ballooning of the duct does not occur during blowing. Amazing architectural design of the human body. Now, this parotid duct is approximately 5 centimeters long and at different points along its length has mean diameters ranging from 1.4 millimeters and 0.5 millimeter with a maximum of 2.3 millimeters and a minimum of 0.1 millimeter depending on the site. It is named after the Danish anatomist Niels Stensen 1638 to 1686, also known as Nicholas Steno, and therefore called the Stensen's duct, and he was the first to describe it initially in a sheep in 1660. His colleague Sylvius confirmed its presence in the human body, and Van Horn in Leyden named it after Stensen and therefore called the Stensen's duct. Lies close to the buccal branch of the facial nerve, also close to the transverse facial artery. Again, blockage. What is the clinical significance? Blockage, whether caused by salivary duct stones or external compression, may cause pain and swelling of the parotid gland called parotitis. Now, one must remember of late, because of excessive use of mobile phones and because of its heating up and heating of the acini, there is a rampant epidemic of parotitis by excessive usage of mobile phones. Coplic spots, which are pathognomonic of measles, are found near the opening of the parotid duct. Coplic spots near the opening of the parotid duct, pathognomonic of measles. The parotid duct may be cannulated by inserting a tube through the internal orifice in the mouth. Dye may be injected to allow for imaging of the parotid duct. That's the parotid duct. To draw a line from the lower aspect of the tragus to the midway between the facial ala and the upper labial, and the mid third of the line is the surface marking for the parotid duct. The parotid duct. Again, the duct is named after Nicholas Steno, also called Niels Stensen, a Danish anatomist, and therefore its name originates from his name, the Stensen's duct. Herein, therefore, we have a comprehensive review of the parotid duct.